I said, Charlie was never the door. He told me. What's that? But we're the super, you told me.
Okay, I'd like to call our meeting to order and welcome everyone. We're going to begin tonight's meetings, and then Legislator Davis is going to begin as the Chair of Government Operations. Call that meeting to order.
Okay, we're going to have open the special committee meeting for government operations at 6:01. We have one proposed action item, appointing county legislator, District 1, Catskill.
Martinez, Lavero second.
I'll second that too.
Hobart second.
Mike, second. Second. Warrington.
So everybody on the committee?
All in favor?
Aye.
Aye.
Passed. I don't believe, is there anything else coming before government ops today? Motion to close?
I'm sorry, could I just have the seconds again? Just to make sure.
Yeah.
I'm sorry,
Everybody on this one.
it's everybody
They
on.
went down to committee.
I didn't hear.
The one with
so I wasn't-
Yeah.
Okay, thank you.
Do I have a motion? Motion to close. Second.
I'll second.
Thank you.
Ready? Call special finance committee meeting to order. One proposed agenda item, appointing Greene County Legislator District 1 Catskill. I'd like to make that motion.
I'll second it.
I'll second.
Any more?
I'll second it.
Let's go.
Second.
All in favor?
Aye.
Opposed? That's
Aye.
carried. Oh, Linda.
Linda's on Zoom.
It's
Oh.
Linda.
Okay. That's passed. Is there anything further coming before special finance committee tonight? If not, I'll entertain a motion for adjournment.
Motion to close.
Second.
Well, thank you.
I'd like to call our special legislator meeting number 1 for the year 2022 to order and ask everyone to please rise for a moment of silent prayer. May we join in saying the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ask Linda for the roll.
Vice Chairman Rivera, we have all legislators are present, with the exception of Chairman Linger. And we have one legislator on remote and one absent. Oh, I'm sorry, one vacant.
Going to move right into the items of tonight's agenda.
Resolution number 39-22, appointing county legislator, District Number 1, Catskill. Moved by legislator Martinez, seconded by legislators Davis, Overbaugh, Hobart, Legg, Rivera, and Lennon.
Second by legislator Blumer,
And
legislator Handle. True. Legislator True, legislator Thornton. Any other seconds? Legislator Legg. All in favor?
Aye.
Opposed?
Aye.
So carried. Congratulations to Jay. I'd like to invite the new Catskill legislator, Joseph J. Lucas, Jr., to come to the front of the room with his wife for the oath of office. Mr. Kaplan will give the oath of office. After that, Jay will be signing.
is there a roll call?
It says roll call.
It does say roll call. Yeah.
I think you had it.
Oh, okay.
Everybody seconded
Oh,
it
that's
anyways.
true.
Call the vote.
Yeah, license.
Harry, could you-
I do.
Jason, please put your left hand on the Bible and please raise your right hand and repeat after me. I, Joseph J. Lucas Jr.,
I, Joseph J. Lucas Jr.,
do solemnly swear that I will support the Constitution of the United States
do solemnly swear that I will support the Constitution of the United States
and the Constitution of the State of New York,
and the Constitution of the State of New York,
and that I will faithfully discharge the duties of Greene County Legislator.
and I will faithfully discharge the duties of the Greene County Legislator.
Thank you, Jay. Lucas,
Thank you, sir.
you did enough to sign that oath. And you know it's my pleasure to swear you in.
Thanks, sir.
Congratulations, Jim. Take your seat right up here.
Charlie, me, Harry. The cupcakes are really for Jay.
And at the end of this agenda, you'll notice that there's an amended standing committee assignments for 2022. That now includes legislator Lucas, who will serve as a member of County Resources, County Services, Government Operations, and Health Services Committee. As this is a special meeting, there is no further business to address. So we can get a motion to adjourn. Make the motion by legislator Hobart.
Second.
Then we're going to move into tonight's committee meetings. Legislator Handle, opening Health Services Committee.
Good evening, everybody. We have Health Services Committee meeting at 6:09 p.m. Yeah, Jason could not be here with us tonight, so Amanda Lyon is here. She's going to give us an update. There are a lot of resolutions here for mental health. Thank you for being here.
So just a brief summary, as the local governmental unit, we manage all the pass-through funds for the state aid awards. So 4 contracts that are before you, or any amendments that were to prior year budget for the new contracts. So with the exception of 1 contract, 3 went up with COLA adjustments. Their cost of living for certain staff that apply to certain programs. There is no expense to the county for that. And then the 1 contract that is a decrease is the PROS program for Mental Health Association has moved to Columbia County. Therefore, their quarter funding for the first quarter in 2020 was removed from, or 2021 was removed from the 2022 contract.
Does anybody have any questions for Amanda? Thank you very much. I appreciate it. We also have with us here tonight Kim Kaplan. Laura, yes, and Laura Churchill. They're going to give us a briefing on COVID, and I know a couple of people had some questions that they wanted to ask, so we're here to answer them for us.
Good evening. For anyone who doesn't know me, I'm Kim Kaplan, Director of Public Health at Greene County. Just a brief overview first. I know there are questions. Our active positives as of today, 138. So that's quite a significant decrease from the high on January 12th, which was 1,546. So quite a difference. We did have 43 new positives today. If we look back to that date of our all-time high, we had 282 new positives that day, so quite a change. Also of note, we still do have 22 hospitalized, so that's quite high. Our high ultimately at the middle of this past January was 40. We had 40 in the hospital. And the other, sadly, I had to report, we are up to 109 deaths in Greene County. And in the last, just about a month, we've had an additional 16 deaths. That's brought us up to 109. So quite a lot of activity. One reason for the reduction in the current number of positives was the change early in January to a 5-day quarantine, so that people are coming on quarantine and coming off quarantine as long as they're not ill anymore quite quickly. So sometimes by the time we get the positive test, they're almost off their quarantine, they're feeling well. So there have been a lot of regulatory changes.
Are you still doing contact tracing for 65 and older and 18 and below, or no?
We are doing case investigation on everybody. We have several school specialists. We were able to have 4 school specialists to keep up with the activity in the school, so that was quite important. And we are able to do case investigation for all cases, even at our high. We were able to keep up with that. There was a point where we tried to really, stratify everybody into the highest risk, but we are able to keep up with all of the cases. Contact tracing, the state has gotten away from. What we do is speak to people and, who else do you have in the household? Who else is sick? Do you have another positive in your home? And do you have school-age children? And just to be able to see what the sensitive issues are.
Do you keep a record out of hospitalizations and deaths as to who's vaccinated and who's not?
We do, and I apologize, I didn't bring the count tonight, but recently, most people have been vaccinated, but it is a mix of ages, of vaccine statuses, but we can definitely do a count of that. We keep track of all that.
Thank you.
So Kim, on that, what Darrell was asking, so you have information that says if someone specifically passed away from COVID or other comorbidity issues?
We don't always have the complete comorbidity picture. It depends what the hospital provides for us. Often we do, especially if it's a person who is hospitalized. And whoever declares at the time of death, they state the cause of death. And it should be, if they're declaring COVID, COVID should be the primary cause.
Does public health have access to such data as total US deaths per year and a breakdown of deaths, whether it's a virus or mental health or suicide or overdose, things like that?
There is death data. I know that by state, it's collected differently, and
Right.
there are national statistics, certainly. If you're talking about all individual causes of death and breakdown demographically, it does exist to different levels of detail because some states collect things differently. New York State is fairly comprehensive in these kinds of health statistics.
Okay, so who would be collecting that data for the state?
For the state,
Yes.
it's collected ultimately by the New York State Department of Health.
So it's
If
not
you're
some,
talking about all causes, there are some things it's vehicular, if you're thinking about all causes,
Right.
vehicular and, different areas under different jurisdictions would be collecting that.
so it's not some independent research firm, it's actually a government agency.
Governmental agency, yeah. There's a requirement, we have mandates and there are requirements as far as the information that is collected. So is everything collected somewhere? I would say yes, but it could be different, it could be law enforcement, but there's all different areas.
Were you guys given any information as to why the state has backed off contact tracing? The reason?
The reason they felt that in the time of Omicron, it was not as beneficial, that cases should be investigated. And particularly as things were peaking and the numbers were surging, they felt that the priority was the cases, the actual causes. That being said, there was direction that within a school, within a nursing home, within a congregate living setting, that it was important to do the contact tracing to kind of get ahead of the next case.
Who would have determined that schools happen to be a high-risk area that would require contact tracing?
State Department of Health, the Department of Education, and that really comes from the state level. That being said, we meet with the schools at least every week, and they were very interested in having the contact tracing occur. In fact, they became very good at doing contact tracing within their own classrooms because they knew which child's sitting next to which child. They keep the bus rosters, who's sitting next to who on the bus, even to the level of who was sitting next to who in the cafeteria, gym class, extracurricular, all those things. So they really became our allies in that level. They were very good at it.
Currently, do you know that does a percentage even show up for school-age kids with serious COVID illness? Is it even 1% of the of the student population?
Are we talking across?
Nationally, local, statewide?
Yeah, nationally, I can't speak to that. I mean, the numbers of children who are sick has definitely increased. And there are some, as the percentage of the population who is sick increases, you're going to have a certain percentage who is vulnerable, who are vulnerable. And that's what we've seen with adults too. As far as the percentage of serious COVID illness, they're looking into breaking all that down now. Every month, there are greater details.
Well, it's kind of an important issue because, you know, people catch colds all the time. And here we are going through all of these so-called mandates and all these different way of doing things. I mean, are we going to do this for the common cold? Are we going to do this for whatever, the flu, strep throat? I mean,
Well,
there needs to be a determination of the seriousness from that level of children. You're talking about mask on kids all day long in school, around people, around other kids, healthy for the most part, which doesn't show up at the federal, at nationally, it doesn't even show up as a percentage. It's that low. Okay. We had a Supreme Court Justice of the United States declare over 100,000 illnesses, serious COVID hospitalizations for kids. All right, which was incorrect when it was about 3,300 at that said time. And I just want to know why we're putting our kids through this if the statistics don't show it. I understand people's emotion and care or whatever. But if the statistics, the data doesn't show it, why are we spending time contact tracing or telling kids they got to wear masks, or for that matter, get vaccinated for this?
So the flu also kills a lot of people every year. Since we've been masking, there have been a tremendous reduction of flu deaths, just coincidental to this. What they found was this particular coronavirus, and there were many, some not serious, some tremendously serious, SARS and MERS, which killed a very high percentage. And since we've been finding out about COVID-19 kind of as we go, and we know that the spread it spreads more efficiently than the flu, and all the different variants have different characteristics. And because many people became very ill and many people died, and especially initially, we all know there was a disruption in school, children were home, children were isolated. We didn't really get a good sense of how it was affecting them early on, except that many people got very ill and many people died. So there was an effort, and it was felt to be an important effort, to keep children safe because they are vulnerable, because they're our children. and they need to be educated. And then, so from the safety preservation stance, it became to the safe to school stance. So how do we keep as many kids in school as much as possible? It's safe. So that was the next generation. And then it went from the 10-day quarantine to the 5-day quarantine, from kids being 6 feet apart to kids being 3 feet apart. You know, this has been evolving to be as safe as possible with as many kids in person, which they're very effective now, as possible within what we know about the virus. And the virus is mutating, granted, but within the information that we have to keep them as safe and as involved in their education, and their normal education as possible.
What would you say is the percentage of kids that you've seen in schools that are wearing a mask that actually would stop the transmission of COVID? A specific mask.
A specific mask. Well, the thing about transmission of COVID in general is COVID, by definition, this is airborne. They're learning more as they go about the specific one. And as I said, the variants all have different characteristics. You know, some are more serious, tend to be more serious, some spread more efficiently. You know, they have all different characteristics. Masking is part of a general, of a layered approach, which is what they said from the beginning. Like, wash your hands. When people are sick, stay separate. Masking protects just mechanically what I'm exhaling, and when I speak loudly, there's more, and what you are receiving. Now, there are all different levels. There are the levels that we wear when we do COVID testing. You know, there's all different levels, and there are different levels of efficiency. And what they're finding now is that just that level of protection, if I'm wearing a mask and you're wearing a mask, particularly kids sitting together in a classroom for long periods of time, I mean, the whole day, that it does afford them some level of protection, especially because they're trying to put them closer together to get more people in the classroom, in the cafeteria, and on the bus. So that was kind of the trade-off. So they're trying to do better ventilation, better hand washing, better masking. I mean, do they have to eat lunch? Yeah, they have to eat lunch. So they're going to be together. They're going to eat their lunch. They're going to mask again, and you know, just trying to mitigate the risk. I can't give you percentages of masking. Masking, we're talking about all the different kinds of masks have not been studied in a lab. You know, when you're talking about a mask that someone's wearing for a high level of risk, just like all other specialized masks that people use in industry and so forth, there is more research.
One just last thing, if there is the research that has been determining the effectiveness or not effectiveness of any mask and the effectiveness in schools, I would love that forwarded to me. If you know of any research that's been done that tells us through research data that masks are effective for kids. The last question I have for you, the FDA is looking to approve this vaccine at a lower dose to what, ages 2 to 5 or 5 to 11?
6 months.
6 months.
Is in place.
So are they using the peer review, the group of independent doctors that are not associated to anybody? Because I know they circumvented that peer group for the higher age kids. So why would a peer group for peer review of doctors be circumvented before a vaccine is allowed?
I don't know anything about that. I know it's a very rigid, standardized process in the pharmaceutical community, pharmaceutical industry. It is a very formal, rigid, standardized process, all of which has to be followed. So with babies and children, it's even a more rigid process, which is why it's usually the last group.
Could you please find out if there is actually that review being done by the group of 15 doctors that are independent on the lower age bracket? And also if it was done for the higher age bracket of kids. I'd be curious to know if there was actually done. I was told and I looked into it and I did not see that it happened. I saw it was circumvented.
No, they did it and the doctors said, no, this is not a good idea.
So the doctors, this independent group says, no, this is not a good idea, but we move forward from the federal government perspective which then gets pushed down to state government, which then gets pushed down to county public health departments, telling us we're supposed to put an experimental vaccine under emergency use into kids' arms.
So we do not have a vaccine mandate for children, but the United States has a pretty stringent process, in fact, quite a stringent process for approval, especially approval of children. But I could forward to you the information I have on that process.
Okay. Thank you, Kim.
Kim, I just have a couple of questions also. The testing numbers, like, I know we recently had a testing.
We had testing today. They
So how
really
many-
diminished.
How many did we have today?
Today, we had 10 tests. This is at our site in Cooksaki. We stood up a testing clinic because the demand was very great. So we had 10 tests today and 2 positives. And that's because, the numbers are going down, but really because of the extensive distribution of the home tests. So as the home tests go up, and we have a reporting system for the home tests, and we do have quite a lot of people report, I cannot guarantee everybody. And we always count the home tests in our numbers. We incorporate them into our numbers. So as you can see, it's really gone down from when we would have hundreds. Yeah.
So, and then what about the vaccines? I know we had one up at Hunter. What was the attendance on that?
Quite low. It was quite low. One of the things where we are really fortunate, for a small county, we have a tremendous number of vaccinated pharmacies. Besides the fact that we have proximity to Albany and they have the state site there where they have all the different vaccines if you have a particular kind you want. But we have a lot of very active vaccinated pharmacies. So people are able to access vaccine. We do have a plan working with the state. The state has a Vax for Kids program, and they're doing another initiative right now where you can offer it to schools to have at the school with the parental permission, with parents present, for staff or children. So a couple of schools were very enthusiastic about that in the planning stage right now.
I think also, like, point, people have had the opportunity to get the vaccine, get tested. So the opportunity has been there.
The opportunity.
So how close are we? Is there a discussion of that we're in a herd immunity stage at this point where, because a lot of people that I know have had it already.
That's true.
And the majority of these people have survived and had very, symptoms that were not major. Now, there are some
Yeah, there's
outliers for that. But is there any discussion that we're entering a herd immunity stage?
There is always discussion of that. We're not there yet, but there is not a state meeting where there's not a discussion of herd immunity. It's very actively being looked at. So there's a lot of factors. There's vaccine, there's how prolonged the effect of your vaccine is. We've got a flu shot every year. I know flu is not corona. But they're looking at all those things and the immunity confirmed by infection and how long it lasts. So they're looking at all that and the combination of people who had COVID and are vaccinated, people who had COVID and are vaccinated and are boosted. They're looking at all the different classifications.
Kim, do they also look at people who actually wear masks and people that don't?
A lot of the studies, they're not looking at all of the, everybody in the country.
Right.
But they do studies of things like on a battleship where there was an outbreak and, percentage mask, percentage not mask and spread, that kind of thing. Usually in some kind of controlled environment where they know there are cases, living situations. They look at villages, they look at all these different things where it's a controlled environment. And most of them are field studies.
Okay, but there's nothing that we actually keep track of when someone comes down with COVID. Have you been wearing your mask? Do you, have family members that wear masks, some don't wear masks? And does that factor into some of the things that you guys are looking at?
It is an excellent question. So it's something that we always discuss whenever we speak to people who are positive. We just, who you live in the house with, what is this, what is the configuration of your home? How do you separate? Do you mask? How old are your children? All those things. But on this kind of community level, it's not captured.
Okay.
But it is always discussed because if you have a positive in the house, you have, who's living in that house? That's always the first question.
Okay, thank you.
Kim, just a couple more things. One, several months ago, we came across our desk approving funds from, I don't know, I can't remember if it was state or federal pass-through funds. And it's stating that these funds were to be used for COVID for minority situation for people who were a few months back.
You know what, we've had so many different little funding lines for COVID, they're all a little different, but I know there is some funding that's trying to reach people who have difficulty with access.
They said minority though in it.
Right, but a lot of it has to do with access. And
Okay,
also
so-
encouraging your entire community to become vaccinated, to have the information they need to make their decision.
So has any directive come down from where, or has there been care given from the public health level to minority groups over non-minority groups when it comes to COVID care or COVID testing or any of that kind of things that involve maybe the public health here?
No, there was not a preferential thing. A lot of that had to do with outreach, that people had awareness, education, access, that kind of a thing, that we were vaccinating in different locations at that time. So people, people also geographically, different places like that.
Right.
So really there has been a lot of focus on access.
Sean might know, but maybe you do too, Kim, do you actually know the cost for a COVID vaccine? And the cost of the test kits that, you guys?
We see the cost of test kits. Sometimes we have to acquire them. Sometimes we get them from the state, so we do
Okay.
see that, but the cost of vaccine, no, we don't have a cost for vaccine at this time.
Okay.
But what is the cost to the manufacturer?
Yeah, I don't know what the federal government, which is everybody here, is paying these pharmaceutical giants for these shots. Now, we can argue about the effectiveness of them or whatever, but, be curious to know just how much these actual shots are costing us, because they do get paid for them. We do pay for them. They are not free. So be interesting to know. I read somewhere it was $30 a shot.
$30 a shot for the full dose per individual or
Per shot.
per shot?
So I'm sure somewhere there is a financial
That's what they're paying the provider to inject you with it.
That's just what they're paying the provider. That's not the actual serum vaccine.
Right, it's cost per the administration cost of the vaccine is another thing. But the actual cost per dose, per product, I don't know, but I know that all these things are analyzed because it is calculated, across populations.
Okay. Thanks, Ken.
Question for you, Kim.
Yeah.
The 22 that are hospitalized, were they hospitalized or were they in the hospital and tested positive?
Right, that is always a question. That's a good question. It's always a question. We had a discussion with the state of New York yesterday about that. These should be people where it was their primary diagnosis. Not that if they went in for surgery, no.
Right, but
And
you were saying
coincidentally, they tested positive for COVID.
there's 22 that are hospitalized. Did anybody go in for a procedure and, acquire it while they were hospitalized?
A hospital acquired.
Now, is that
It
fall
does
underneath Greene
happen.
County hospitalized in COVID when?
It should be that it's the primary diagnosis. Sometimes it depends how things are sent to us, because we also get hospital reports where they'll say these are your COVID cases. So hospitals each can do it a little differently. I know we just had a discussion about the state side, because the state does hospitalization data, and both current and historic. And they said they're trying to be very, tease that out, where it's not a coincidental diagnosis. You're there and they test you because you're there, and it happens to be that that's not why you're there. So they said they are really combing through their data to make sure that that is the case.
Now, are they the PCR tests or are they the rapid tests? So that we don't have anybody with a false negative that's in the hospital, like you're saying. Anybody that's in the hospital, they go at the PCR where they send it out to the
They
lab.
have, a lot of the hospitals have, it's a PCR rapid that they're able to do with the more stringent level of testing more rapidly. Yeah, but they all have their different protocols. You know, they've been at this a long time.
And the 10 that were tested today,
Yes.
did they think they had it, or they just did it because they were getting ready to
You
travel?
know,
or do
I don't have
something?
that with me, but we do keep a record of that. I was keeping at it. So there were 2 positives. Mostly they are people who are sick that show up, but sometimes it's because they were contact.
Kim, I did see, came across from the governor's office, a percentage through counties, percentage unvaccinated in hospital, vaccinated. It's almost 50%, 50 to 50. All right, so if you've been vaccinated, about 50% are in there for hospitalization for COVID, 50% basically for unvaccinated.
Mhm.
Could you tell me the vaccinations that children receive for polio, chickenpox? What's the percentage of them getting chickenpox or polio?
Chickenpox is a little different, but yeah, most childhood vaccinations are quite effective.
Okay.
Very effective. It's a little bit different. Coronaviruses are a little bit different. And we do know there are breakthroughs, clearly. So the goal has been to reduce, just like the flu shot, the rate of hospitalization and death. That's one of the reasons for masking, and that's one of the debates, is because if you're fully vaccinated, but we know there are breakthroughs, especially as the strains evolve, that the masking is another level. That vaccine protects you that much in the previous case, that some other level of protection. And then if you have that, plus you're masking, plus you're washing your hands, plus you have some distancing, that all of that is additive. That being said, we have people in the hospital, and we do have deaths of people who are vaccinated. Yeah, it does happen. It is another level of protection.
Kim, one last thing. Do we separate out when you're keeping track of things? This is
Yep.
Corona, this is Delta, this is the Omicron.
That's very interesting. So we are not privy to that those things as far as when something is a variant. That is all assessed at a state level. So what we don't know is the prevalence of a variant in the population. I don't know if Jane Doe has a variant or which variant she has, but I know at this point, most likely it's Omicron. As Delta climbed, we saw how Delta took over all of the positives. As Omicron climbed, we saw that, but we don't know individually, and it doesn't affect their treatment. But the way that the variants have spread, it takes over as the prevalence rate really quickly. It is amazing how quickly it'll go from being, almost all Delta to really virtually all Omicron. It happens quite fast.
Okay. One other thing, is there any way, I don't know if you can do it, but next time you're talking to the Department of Health about therapeutics, because there is stuff out there, it is working. And for people, if we can help them, I mean, instead of them, yeah, you're positive, the next thing you know, they're on a ventilator, don't let it progress.
Right, we
At least you
refer
can treat
people
them.
for medical care. The hospitals have so much more now than they had, it's exponential. Think as far as treating the variants, things that are prophylactic for a vulnerable person who's positive, things like that. When people are ill, especially if they have vulnerability, we really do strongly, we can't demand it, we strongly refer them for medical treatment. Someone's quite ill with fallen ambulance, but we refer them for their medical treatment because there are treatments now. And it is really important. It's a game changer.
Anybody else have anything else for Kim? Kim, thank you for being such a wealth of knowledge. That was a lot of knowledge.
Thank you, Kim. That was a lot of information.
You didn't lose control.
Hey, I don't like that. Thank you very much,
Charlie kept Kim. quiet so that.
Well, Mike gave me his time because his agenda is. All right, we are going to get right into these resolutions. First resolution, authorizing contract, Mental Health Association of Columbia Greene Counties, Inc., with Clubhouse and budget amendment.
Davis.
Davis,
Vera?
Rivera, all
True.
in favor?
Aye.
Opposed? That's carried. Authorizing contract, Twin County Recovery Services, Inc., and 2022 budget amendment.
True.
Randall,
True.
True,
Blumer.
All in favor?
Aye.
Opposed? That one's carried. Authorizing agreement, Greene County Mental Health Community Services Board and the Mental Health Association of Columbia and Greene Counties, Inc., and budget amendment. Hobart, Bloomer, all in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Mental Health, CSB, and Northeast Parent and Child Society, and budget amendment.
Davis.
Davis? Bloomer, all in favor?
Aye.
Opposed? That is carried. Authorizing agreement, Medical Director, Greene County Family Planning. Handle?
True.
True. All in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Family Planning and Russell Sage College.
Davis.
Davis? Handle? All in favor?
Aye.
Opposed? Carried. Authorizing agreement, Greene County Public Health Department and the CDC Foundation. Hobart,
Davis.
Davis, all in favor?
Aye.
Opposed? Carried. Authorizing agreement, Greene County Public Health Department and Vineski and Company.
Davis.
Davis, Hobart, all in favor?
Aye.
Opposed? Appointing member, Community Services Board. Handle. Hobart, all in favor?
Aye.
Opposed? That's carried. Is there anything else to come before Health Services Committee this evening?
Chairwoman Handle, I have one thing for Amanda. We had this youth clubhouse that they received these funds. Do we have a budget that they give to you in mental health for what they're actually doing with the money?
So the way it's set up for the clubhouse model, it's designed by the state, so it's pass-through money, it's no cost to the county, but the structure of that is to provide mostly just the rent for the facility for a director, cover the facility as well as some of the small programs.
Do you currently know where they're renting? Because I believe our community center was bought and closed down.
I don't believe they're
Fantastic.
operating out of the community center, they're down.
They're right there,
there's
right?
a- Yeah.
Where are they?
Right by the parking lot of record management.
Yeah, by the.
White building right there.
Oh,
by the
okay.
parking lot.
All
It
right.
used to be, was it the old HUD? There's some building. Yeah,
Yeah.
by the dump.
nowhere else.
They're in
Okay.
that, on the corner of.
Okay, all right. Okay, thank you.
And just we have a guest to join us, our Assemblyman Chris Day, to join us.
I just came number one, most importantly, to wish Harry Lennon a happy birthday and hopefully that he will save me a cupcake.
You got it right here. You lost my vote, Chris. Oh, be nice, be nice.
And,
Anything else? Anybody?
honestly, a couple other things. I just wanted to thank the members of the Greene County Legislature and some of our local town officials that helped Senator Hinchy and I hand out test kits and masks last weekend in the below zero weather. I really appreciate it. I know some of you couldn't make it, but then you called me and let me know, but we had a really good showing. And it was a great day of community service, and I just wanted to say, I personally wanted to say thank you. I rushed all the way from Albany from session just to get a
Cupcake.
And
did. Yeah.
two other quick things. First, I want to say congratulations to Joe J. Lucas being seated as a new member of the legislature. I think everybody's going to be very happy with his performance. He's a hard worker. So Jay, congratulations.
Thanks, sir.
And lastly, I just wanted to let you know that we're now in budget hearings. Believe it or not, the budget's coming up. If anybody's seen on TV right now, the executive budget, it's around $216 billion maybe. And just to put that in perspective, the average for the years that I've been there, and I've been there 4 years, going on 5, we've never had a budget over 170 or 180 billion, except for last year. But doing my due diligence and doing my job as your representative in Albany, I wanted to come tonight and just put it in folks' minds that if there is something that the county, wants me to bring up in these budget hearings or get some information on, please let me know. If you have a chance, the executive budget is online. Both houses will also be putting a budget together. Or if there are any wants, let me know so I can speak up for the folks at Greene County. I also want to thank Sean Groden. Sean Groden was also at our event that very cold weekend. Sean, we appreciate you showing up and giving us a hand.
There's no cupcakes though.
No, we did have some Dunkin' Donuts, and we had some coffee and hot chocolate, but it was cold. I mean, very, very cold. But again, and we continue to work towards the broadband. Patty Handel had a great meeting over to her place with the folks at Durham. I was able to attend. And, we're going to continue to push PSC and in the budget to make sure that the funding, I do want to give you folks a lot of credit in Greene County. I represent 7 counties, and you guys have done a very, very good job of getting the maps put together and knowing what people in your county have the service and don't. And I think when we go into the grant part, because of Warren Hart's very, very hard work, we're going to be looking pretty good. Hopefully they'll use Greene County as one of the, the test areas on these new grants because you guys have already done your homework. So with that, just want to say appreciate the service and dedication that you give to the people of Greene County, and I'm just here to observe, and hopefully Harry will buy me dinner for his birthday.
He didn't answer.
When it comes to food.
Just blame Charlie Martinez because he called me today and said, "Did you forget today was Harry's birthday?"
Charlie did?
Yes.
Good job, Charlie.
Thank you for coming down.
Absolutely.
Thank you very much.
Happy birthday, Harry.
Thank you.
And Chris-
Congratulations, Jay.
Chris, I would like to say that I think I speak for all of us when I say we are so happy that we get to keep all of you, that you get all of Greene County, we get to keep you as our representative, because you do an amazing job. So
Absolutely. Thank you, Chris.
I need to say that I was as happy as you. Greene County is my second home. My wife would be happy to move here. If I wasn't the chairman of my political party in my home county, I would probably be looking for a house somewhere close to Charlie Martinez, just in case I need something. But I love Greene County. You folks have embraced me. It's a pleasure to be able to work with each and every one of you, and it doesn't even matter what party you're a member of. I consider Harry, even though Harry's a Democrat, I consider Harry a very, very close friend. And I've been able to work with everybody. Larry Gardner, all great people, and it's been an honor and a pleasure, and looking forward to the future. As long as I'm lucky in November, you'll have me back on January 1st. It'll be fine.
Is there anything else to come before this committee this evening?
Motion
Not motion to adjourn?
Motion to adjourn.
Lennon and. You were late, I forgot.
behind me.
We are adjourned.
Lose control.
She lost control.
No, kept it together.
Charles.
Charles.
I'm so forgettable. No worries. There's no resolution.
Like yielded his time to Patty.
Hey, Matt, I apologize. I forgot to add one thing. I want to thank Sheriff Kuzminski and his people at the Sheriff's Department. I'm sorry, but they made that possible. And I would be remiss if I didn't thank him. And also Marilyn Farrell for braving it out that day as well. But Pete, thank you to you and your folks for opening up the property to us and helping us keep people from getting run over. Thank you.
Harry is rubbing off on you.
Mike, he asked me the other day if he could start riding around with me because he's retired.
Oh, I'm gonna get a picture of that.
Yeah. Probably jumping the fence.
Okay, I'd like to call county resources to order at 6:50. We got no action items here for the month of February. A little bit of info. Reached out to our Greene County guidance counselors. They're working to put together a meeting with them, and when they get that together, they will forward that information to us, so anyone available can attend here as legislators to see what they're doing. We also are fortunate to have one of those guidance counselors is also on the Board of Trustees at the college that represents Greene County. So there's a little bit of work going on there too on that. Besides that, there's not much going on here for these other departments. So if anybody has anything they'd like to look into or bring up before county resources, any departments at all, please let me know, and we'll certainly get them on the agenda. Before I close this though, and it's not really related to the health department anymore and health services, it's really related to what's been going on at the government of New York State with this mask mandate that goes back and forth, back and forth, and back and forth. And fortunately, we've got an assemblyman here, and I'm just curious if anyone in this room can tell me if there is actually a law that was passed by the legislature and signed by a governor that gives authority to any commissioners of any of these departments to issue a mandate.
I can answer that question.
And what do you got?
The answer is no.
The answer is no.
I wrote a letter to the governor yesterday. If you go to my Facebook page or Twitter page, you'll see the letter. It was signed by the majority of the members from our Congress asking the governor to drop the appeal from the court decision in Nassau County because we don't feel that she has the authority that have made the mandate to begin with. The state constitution requires that the state legislature pass for a bill to become law. Now, legally, when Governor Cuomo was governor, there was a time frame where he did have the authority for some executive mandates. And that was given to him by the legislature, was at the very beginning of the pandemic. That time frame has went. If you remember, the state legislature, several times, both the Republican Senate and the Republican Assembly brought bills to the floor to end his executive powers with regards to the pandemic. Of course, it was blocked every time. But then it eventually, the time frame ran out. And for her to be able to keep those mandates in place, she would have to bring it to the floor of the legislature. That's our argument. We believe that the Constitution is on our side. I was very disappointed that the appellate division gave a stay after the judge made his decision. Like I said, we have taken action on our side. I don't know, what's going to take place. The letter was just sent today. But we did ask her to drop the appeal because we don't feel that's constitutional.
What is the remedy if they don't abide by the Constitution?
Well, I will say this, the remedy is there's an election in November of this year. And you need to put people in positions that are going to abide by the Constitution and the will of the people of the state of New York.
But a lot of the places that you're going to that you have to wear a mask are privately owned businesses, and they don't want you in there without a mask.
And that's their choice.
Right.
And that's the point that we're trying to
That's
make,
fine.
is that you have to abide by the rules. Listen, if I go to a school or I come here, if there's a rule that says I have to wear a mask, I wear it. I don't ask any questions. I don't make a big deal out of it. I do it. It's, you know. But that's the point that we're trying to make, that it should be up to people, you know, as far as schools go. I think it should be up to the parents. I don't think that other people should be telling you what you have to do with your child. It should be parental choice. It's your child. It's the same thing with these businesses. If you own a restaurant, and I go to your restaurant, you have a sign that says all patrons must wear a mask except for when sitting and eating. I'm either gonna walk away and go somewhere else because I don't like your rule, or I'm gonna go in there and I'm gonna abide by it. And that's the whole point. That's why we're Americans. We live under a constitution. We have the freedom of choice. So that's my feeling. I think that there's a lot of people out there, and it doesn't matter what political party you're part of, have that same feeling. They like to have the freedom of choice. Yes, you have to have some common sense, and you have to do what's right for you. You have to do your own research and figure out what's right for you. I'm vaccinated, 100%. I've got both my shots plus my booster. But I did what I thought was right. I went to my doctor and I asked them what I should do. But I don't think that government should be telling somebody whether they have to stick a needle in their arm or not. It should be your choice. There are other medical things out there that people jump up and down about having freedom of choice. I really don't understand what the difference is when it comes to your personal health. If you're someone that is adamant about having to wear a mask or be vaccinated, then go do it. You shouldn't have to worry about what anybody else is doing. Worry about what you have to do to protect yourself. And that's the way I do it. I wear a mask when I'm in a position where I think I could be the danger of somebody else, or somebody could be danger to me. I wear my mask. Or if I go to a place where it's mandated that because it's a private business and they own it. As far as the vaccination went, I went to my doctor and I asked him what the best thing for me to do. Because I'm not a medical professional. I didn't know if the thing was good for me or not. I went to the person that I trust that takes care of my medical needs. I feel that should be the same way. I mean, a report came out today about the shutdowns. We shut all these things down and come and find out we didn't have to. And we cost people their jobs. We created economic problems that we may not be able to solve for years. But nobody took the time to really analyze and see what we should have done. Everybody jumps and they got to take a political position on everything right away. I think that people are a lot smarter than we give them credit for, especially people that are in government. So I meant the other way around. I think some people are smarter than people that are in government.
Oh,
What I'm
safe.
saying.
Thank you, Chris.
Yeah, I hope I answered your question.
Anybody else have anything to come before county resources? Motion to close. Motion to close, Thornton. We are, anyone? Second? We are closed.
Good evening, everybody. I'd like to call Public Safety Committee to order at 7 p.m. We have 4 proposed action items, but before we get into there, we have Deputy Director Randy Omerod from the 911 Center.
Thank you, everyone. Over some quick numbers here for you. Last year, we catted 32,116 calls for service across all disciplines, being EMS, police, and fire. For the month of January, we catted 617 EMS calls, 174 fire calls, 1,999 police calls. And then we also catted 786 other type calls for our calls with mental health, DSS, public health, and throughway calls. We're pretty busy in the 911 center. The dispatch consoles that were here located at the county office building were relocated to the PSAP and are up and working. There was some extensive electric work that was done. They were relocated from the county office building because of the COVID crisis, hit the 911 center, taking out half of my staff. Room was going to be used for members who tested positive and asymptomatic and or needed to be quarantined, that they could still work if they were also asymptomatic. The generators and battery backups at the emergency services building and all tower sites have been tested and in working order in preparation of a potential storm that's supposed to hit later tonight through Friday. They're predicting snow, ice, and freezing rain. Pending weather, there will be a shipment of home testing kits being delivered Friday to emergency services. These will most likely be given to public libraries. I believe that Sean and Dan King have been working on that. We will then pass them out to the public that wants them. Previous tests were given to county departments, towns, village halls, and the Chamber of Commerce. And today we had a new furnace put into the admin side of emergency services. This was done under emergency purchase because the old one that was 20 plus years old went down over the weekend, and the admin side of emergency services was less than 50 degrees inside. So we had to worry about pipes and everything else that were inside. So, but everything was put back in place today and up and running. So that's what I have.
Randy, I like to talk a little bit about the two stations that you and Director Farrell put into place. I had the opportunity to take a look at those.
Yes.
You and John showed me around, and it was one of the smoothest operations that I've taken part in the county to get done. I think the whole thing got done within a week.
Yes.
I want to say. So in the event that we have our dispatchers exposed to COVID and have COVID, we could keep two different teams working.
Correct.
They have their own entrance, they have their own bathroom, and they have the two stations that are up and running. And then they took me into the, I guess you would call it your computer room, your mainframe room. And I recommend that we all take a look at that. I don't think the legislator's ever been in that room. I would recommend it. If you got time, stop by, ask John and Randy for a tour. It's very impressive. So I say thank you for what you did there. And I know there's going to be some talk in the future about petitioning a section of that off to make it its own room. There's plenty of room down there to do it.
Definitely.
I'm glad Charlie voted to put a second floor in that building, because if we didn't, we'd be in bad
That's my
shape.
building.
Yeah, so,
Never mind the garage.
yeah. So you and John did a great job, and I thank you.
Thank you.
I know Mike's gonna probably say, well, there he goes. There, it's your birthday. No, it's a great job. It really was.
Thank you. Anybody else? Any questions? Great. Thank you very much.
Thank you, Randy. And also with us this evening, we have Sheriff Kuzminski. Pete? Hey, Harry, is that the room next to the kitchen you were telling me about?
It's downstairs. Oh. Got you. I did impressed.
Good evening. I'll try and make this a little quicker since Chris took up all the time. All right. This month we did 93 civil attempts, served 56 civil papers, issued 87 traffic tickets, investigated 30 traffic accidents, made 19 arrests and 1 DWI arrest. We handled 423 calls for service, made 194 traffic stops, and issued 8 Narcan rescue kits. On January 1st, the starting jail population was 36. As of January 31st, it was 40, the high this month being 40. Corrections officers did 24 transports, traveling 786 miles, totaling 34 hours, and moving 28 inmates. We have 1 state-ready inmate in our custody. As a note of interest, we currently have 7 inmates accused of murder or attempted murder in our custody, one of which is accused of killing another inmate while inside Cooksaki State Correctional Facility. We also have an 8th one, but he's currently being housed at Marcy or Walsh RMU, but he's medically not fit to return yet. Most of the inmates we have, needless to say, have been charged with serious violent crimes. Consequently, we're seeing more violent behavior inside the jail. We're continuing to move forward with our LEAD program and are working in conjunction with John and Randy and the EOC on improving our communications capabilities. And lastly, I need to mention Deputy Jay Lucas. He's been an asset to the Sheriff's Department for over 36 years, and he's going to be sorely missed. I can't find another man who is above 65 who wants to work 90 hours paid per year. So it's going to be tough to replace, but we're working on it, Jay. He's been an asset to the Sheriff's Office, and we certainly we're going to miss him. So, but he did retire once before. Right? How long ago was that? Jay?
Last century.
Last century, okay. I don't know, we're gonna do something, but I don't know what. So congratulations to Jay, and wish you luck in his new title as Legislator Lucas. Gonna be hard for me not to say Deputy Lucas, so congratulations. Any questions, comments? Awesome, thank you.
Talk to you after this. Okay, and the proposed action items. First resolution, authorizing a contract, Greene County and New York State Department of Corrections and Community Supervision's Office of Nutritional Services to procure food products for the jail.
Martinez, Bloomer.
Martinez, Bloomer. All in favor?
Aye.
Opposed? So carried. Second one, reappointing Greene County Deputy to the Emergency Service Coordinator.
Handle.
Lucas. Handle.
You're not on there.
You're not on there. Handle Hobart.
You're not on there.
All in favor?
Aye.
Opposed? So carried. Next resolution, appointing members to the Greene County Fire Advisory Board.
Lennon, Martinez, second.
Got Lennon and Martinez. Just to let everybody know, I was in contact with the mayor of Cooksaki. They do have somebody they were working on for hose company number 3, so we might have to revisit this at a later date.
Yeah, we get that.
Add that person, because the person that's usually there, there's something going on. So I did make him aware of that.
Good.
Have a motion and a second. All in favor?
Aye.
Opposed? Carry. And the last resolution, appointing additional member to the Greene County Hazmat Team.
Martinez.
Martinez, Handle. All in favor?
Aye.
Opposed? Carries. Anything else to come before public safety committee?
I will entertain one for adjournment. Second.
Martinez, Handle for.
Just a reminder, we have a workshop meeting on Wednesday.
Wednesday.